Do you have a bone spur? Are you concerned that they could be passed down genetically? Will they disappear or go away, or are they here to stay? If you'd like to find out the answers to this question, be sure to watch this video. Hello, my name is Dr. Tan Chin-Boon, and I'm a Hong Kong registered chiropractor. And today I would like to talk to you about bone spurs. And what are bone spurs? To put it simply, actually, bone spurs, they are these smooth bony outgrowths that are formed on our joints due to a persisting increased force on that particular joint. And so when this occurs, it may lead to injury of the joint or even instability. And so in response to this, the body would remodel the bone by making it produce even more bone. And this production of bones would help to provide support and stability to the joint. The medical term for bone spurs is known as osteophytes. And the term bone spurs is actually a bit of a misnomer because it will lead people into thinking that these bony outgrowths are sharp and they are poking and they are jabbing into the surrounding structures of our body and causing us pain. The reason for this is likely due to the presentation of osteophytes on X-ray imaging, where they often appear to be sharp and jagged. But this is actually not a direct representation of your anatomy, because what X-ray imaging attempts to do is to create a 2D representation of a 3D object. Structures that are smooth and round in 3D or in real life, such as the vertebrae of the spine, they appear to be sharp and angular on a 2D image due to how X-ray is taken. The angle is coming on this way and it's only taking one side each time. So osteophytes, which are uneven bony growths, they're going to appear sharp and jagged as well. And this leads to the term bone spurs. The most common cause of osteophyte formation is the wear and tear that occurs as we age. However, younger people may also develop osteophytes if they have been persistently overusing or overloading their joint for a prolonged period of time. An example of this would be obesity, in which excessive weight is put upon a joint for a long period of time, as well as athletes who suffer from sports injuries may also increase the risk of developing osteophytes. However, no matter the age, females are actually more likely to develop osteophytes than males. And rarely, there is also a genetic component which predisposes someone to a hereditary form of osteoarthritis, which can also lead to the formation of osteophytes. Other diseases that may also give rise to the formation of osteophytes include gout, ankylosing spondylitis, as well as psoriatic arthritis. So osteophytes are not always symptomatic, but they are able to cause some indirect symptoms, especially when they are narrowing a space where ligaments, nerves, or even muscle tendons pass through. And the most classic example for this would be in our spine, where if there were a osteophyte that is growing over here, it would tend to narrow the space where the nerve root comes out of. This is known as our spinal canal. And when the spinal canal is narrowed, it is possible that the nerve would get impinged, and so it would start to send symptoms down our lower limb, giving tingling or numbness, and sometimes even weakness of the lower limb. That is worsened when you bend your back backwards like this, because this action further decreases the space of the spinal canal. Another example that I'd like to show you is also in our shoulder. If there were osteophytes growing out from here, it would also limit the space available for the rotator cuff tendons as well as the ligaments to pass through. And so you might notice that there's some restriction of movement in the shoulder due to this. Here are some frequently asked questions regarding bone spurs. The first question: I was told by my doctor that I have a bone spur, but I'm not having any pain at the moment. Should I get it treated? If you're not experiencing any pain or discomfort related to the osteophyte that was identified, then there is actually no need to treat that osteophyte specifically. However, you should know that the presence of an osteophyte means that there is probably an underlying cause to it. Therefore, you should consult your healthcare professional to help you identify what is the root cause of the bone spur formation or osteophyte formation, so that you can have a better understanding of your condition. Are bone spurs hereditary? No, bone spurs are not hereditary per se, but if a patient has a genetic predisposition to early degenerative changes, then that can increase the likelihood of the formation of bone spurs. Will they disappear or go away, or are they here to stay? No, bone spurs, they generally do not disappear or go away by themselves, because they are often just a response of a joint towards overloading. The body remodels the bone by causing it to grow even more, and this would help decrease the amount of stress that's subjected to the joint, or even reduce the instability of the joint. In symptomatic cases, symptoms that are associated with the bone spurs generally respond well to conservative care. However, if you are experiencing symptoms that appear to be becoming more and more progressive and is not responding well to conservative care, then you can consider surgical intervention. If you found the information presented useful, please do like, comment, and subscribe to our channel to learn more about chiropractic and physiotherapy. If you have any questions, please do leave a comment below. And I'll see you again next time. Bye bye.